Hey everybody, Dr. Hagmeyers here, and today's video is another video in our SIBO series titled Everything You Want to Know About SIBO. We've talked about many aspects of SIBO, its causes, reasons for relapse, best probiotics that you should be taking. We talked about biofilms and prokinetics. We talked about the different kinds of testing, but all of the things require that you work with a doctor treated in functional medicine. That's why in today's video I wanted to share something a little bit different with you and something that you can do right now while you're watching this video, something you can do in the comfort of your own home. All right? Today we're going to be talking about the ileocecal valve massage, or the IC release technique, how you do it, how long you should do it, what are some of the scenarios that might indicate that you would benefit from massaging the IC valve, and what are some of the indicators where a person has ileocecal valve dysfunction. Again, some of the symptoms. So I'll explain the technique first, and then I'll explain a little bit later in the video, I'll get into why it malfunctions, some of the symptoms of a malfunctioning IC valve, and then again, all the other aspects of that ileocecal valve. So let's kind of jump into this. The IC valve, of course, is a muscular sphincter, and it's found where the small intestines connects to the large intestines, and it's really located above the appendix in the lower right-hand quadrant. If you look at this image, when we say the right side, it's you, the patient's right side. And so again, because of its location above the appendix, many times when people have pain in the lower right quadrant, a search on the internet pulls up the appendix, and it's one of the differential diagnoses, along with ovarian dysfunction, that your doctor will need to determine. Right? On the human body, the ileocecal valve is very easy to locate. You'll want to find a flat surface, and while you're laying down with your knees bent, what you'll want to do is you'll want to take your left index finger or your middle finger, and what you'll want to do is you will want to find your belly button. All right. With your right hand, you're going to want to find the front part of the pelvis. It's the bony projection that really sticks out, as if you were putting your hand on your waist. Now that you know the location of the ileocecal valve, the technique I'm going to share with you has been found to be very, very effective for the relief of a wide range of gastrointestinal symptoms. Things like nausea, things like constipation, and things like diarrhea and bloating and belching, and many other symptoms that are related to IBS. The next thing you want to do is you want to use a gentle but very firm pressure, and you want to palpate around that quadrant, around that area, for any areas of tenderness or hard nodules. All right? These tender nodules can be the size of a large marble, and you'll feel them underneath your fingertips. All right? Now, once you locate these areas of tenderness, you're simply going to want to massage these areas in an upward, clockwise direction and in a circular movement or circular motion. Right? This tension must be massaged out in order for this valve to function properly. So for some people, the first time you do it, or the first couple times you do it, you may have to spend more time doing it, and then over the next subsequent days or weeks, it'll get easier. Okay? Now, it's not uncommon that while you are self-massaging these areas that you begin to notice some abdominal noises. Maybe you start to notice some gurgling. Maybe you notice that you pass gas, or you start to have some flatulence. And you may also notice that within 15 to 30 minutes, you actually have to use the bathroom. Right? Many of you are probably wondering how often you should repeat this procedure. Right? So this is really going to vary, again, from person to person. But I would recommend that you do this a minimum of 2 times per day, morning and night. And the best time to do it is, of course, between meals. Right? You may remember that that's the time that the migrating motor complex is the most active. And so again, each time you do it, I'd probably spend 3 to 4 minutes doing it. It doesn't take long, and you may need to do it, like I said, several times before you start to notice any change to the degree of soreness and tenderness. But in time, I promise you, it will begin to dissipate. All right? Now, everybody, again, is different here, so use your best judgment in terms of how frequently you do it and the amount of time that you spend doing it. Over time, though, this area that you're working on should become more mobile, it should become less tender, and it should be a whole lot easier, and you may even start noticing some changes and improvement. All right? So again, that's going to wrap up today's short video. If you found it helpful, be sure to leave a comment below, and don't forget to subscribe to our YouTube channel. Hope to see you next time. Take care.